This is Darwin Shurig, president of Shurig Solutions Incorporated and a member of the MRI family, focused on solving the largest problems for med device, IVD, and pharmaceutical companies for regulatory quality and engineering. And also, along with providing opportunities for career advancement for our following, also bringing opportunities to learn from subject matter experts like Chris. So very excited to have Chris with us tonight for this conversation surrounding quality. Chris has a bachelor's in biology, master's in business administration, and has been in the medical device industry for 16 years, 11 of those in a leadership position. He spent the last 6 managing a team of 14 or 16, I'm not somewhere around there, overseeing 40 manufacturing sites for Medtronic in terms of creating best practices for suppliers, including selecting suppliers, setting up supplier scorecards, surveillance for nonconformance. He has extensive experience in process improvements for suppliers to create an atmosphere, more of a proactive partnership in terms of that transfer versus a reactionary one. Additionally, strong experience in decreasing the cost of poor quality scenarios, compliance with field action, as well as risk management and recall assessment. So welcome, Chris. I'm really excited to have you on tonight. Very excited about the topics that we're going to talk about and the value that's going to bring our watchers, listeners tonight.
Oh, perfect. Thank you very much for having me on board. I'm looking forward to it.
Awesome. So we're going to start off right off the bat here. I'll go ahead and I believe you have the ability to manipulate, but I'll go ahead. Let's see here.
You should be able to see my screen now.
Okay, perfect. All right. So I'll go ahead and let you sort of lead us in with our first topic here in terms of supplier quality.
Absolutely. Thank you. Thank you for having me on board here tonight and, giving me the opportunity to speak about supplier quality and how we're managing through our current post-COVID world.
Absolutely.
So we'll kick right into it here. And, we're going to go through a little bit about myself, or, go through a visibility bio, go through the regulations, on purchasing controls and our supplier world, non-conformance trending, go into developing scorecards, some situations there on how we may want to do that, go into some supplier evaluations, and then a little bit about managing remote employees, as it's a topic for all of us managers out there right now that are living in the post-COVID world. And then we'll close it off with some final thoughts, and at the end we can open up the questions. There is a chat feature on the right-hand side. So if you have anything specific on any of the particular slides that you want to go through or want to discuss, feel free to type your chats in there, and we'll try to get to them all as we go through here.
Yeah, and I'm definitely excited about.
So this slide is what we call a visibility bio. So a good friend of mine and colleague, Edgar, introduced me to this a few years ago, and I think it's a great icebreaker and gets us started on these topics on who am I, where do I come from, and so it gives a little bit about professional, but also a little personal. So I've been 15 years in medical devices, the last 6 in supplier quality. Within those 15 years, I've worked in biological services, did a lot of work in design verification, validation, spent a lot of time in hospital ORs doing usability engineering, worked internally with product holds and field corrective actions, and then also risk assessments on those field corrective actions, and then got into supplier quality, and then most recently just was awarded a Global Quality Excellence Award for the work done in supplier quality. As Darwin stated, I have a bachelor's in biology, and last summer I finished up my MBA. So what I like about this slide is it gets into some of the top strengths. So these are obviously my opinions of myself and my assessment of myself, but achiever, restorative, strategic, futuristic, and competition. And I think that's what really drives me as a leader in the industry and a leader in the field. Go to the right-hand side and go over to the core beliefs and other quotes. So 5 points if you guess the movie, but get busy living or get busy dying. I think it's a great quote from Shawshank Redemption, and it's really just saying, just keep living your life. Don't let the past hold you back, and just keep living your life, because if you're not living, you are dying. And then the right-hand side, Henry Ford, when he said quality means doing it right when no one's looking, and that's really a good point for all of quality. Be on the lookout and do the right thing even when no one's looking. And then little fun facts. So after I graduated college, I went and got a 100-ton master's captain's license. So the fun fact there is, car ferries, people ferries, things like that. I'm actually licensed to drive those. So, always got a fallback plan if needed. After college, I commercially fished, and I still fish in a lot of tournaments. I was born in Belgium, so I won't be participating in the 2020 presidential election. I can't be a candidate because I wasn't born in the U.S., but I am a U.S. citizen.
No need to write you in.
Yep, no, don't write me in. Save your vote.
Right. Fair enough.
Well, let me go back there. And then, another fun fact, I recently became a Peloton rider, so I purchased the bike, and I just hit the Century Club, so I've hit 100 rides. So up here in the middle, my family, I have 2 boys, Cooper, who is just started the 1st grade today, and Jackson, who started the 3rd grade today. And just a couple various pictures of tournament fishing, the boys, coaching Little League and sports around town, and some nice first place checks from some tournament fishing.
Nice.
So, kind of in summary, I love this tool. It's great for ice breaking when you're meeting new people, when you're getting into new situations, and you want to understand, and you want the person that you're talking to understand a little bit more about you. It's a great tool, great icebreaker, and there's other components to this too, but this is my favorite piece.
Well, I appreciate you going through that for everybody. I think, one of the cool things, I think we're going to bring a lot of value from your experience in talking about these topics tonight, but certainly anybody that knows you, and I've really enjoyed the opportunity to get to know you better over the last year plus. You're a great individual, high integrity, and I'll point out, because I think it's really cool that you adopted both your boys, I believe, which I think is
absolutely. Yeah, both were born out in Utah, and my wife and I made the trip out there for both of them. So great experience, great opportunity for my wife and I to have children that way, and we love every minute of it.
Nice. Well, let's jump into the first topic here on the agenda, which is regulations and setting up purchasing controls as you delve into the supplier side of the business.
Yeah, so we're going to be focusing in on the FDA regulation 21 CFR Part 820, and then the ISO 13485. So we're gonna start by breaking those two down and understand, what do they say about purchasing controls? What's their thought process on them? So, here's 820.50 on purchasing controls, and you look at, there's a lot of words in here, but what does it really say? It says each manufacturer shall establish and maintain procedures to ensure suppliers can meet the requirements. So I think that's a key point to pull out, that as manufacturers, we need to have procedures to make sure that the suppliers can meet what we're asking them to do. The next part of it is, we need to evaluate and select those suppliers based off their ability to meet those requirements. So, we set these requirements, but when we're selecting suppliers and we're evaluating them, we got to make sure that they can actually do what we're asking them to do. I think that's a key point, and we'll get to that more too when we're talking about supplier evaluation and also non-conformance trending and things. It'll touch again on that. Define the control based off the supplier type and evaluation results, and have an approved supplier list. So, supplier type and evaluation fight. All suppliers aren't equal. So you can have a pest control supplier that's monitoring your environmentals in your manufacturing room. They're going to be very different than a contract manufacturer or a critical component supplier. So, break those suppliers down, understand what their risk to your business is, what the risk to the finished good is, and then evaluate them and manage them appropriately.
So, Chris, I'd like to ask you, so like in the time frame, and I started my business in 2015. I mean, I've seen multiple scenarios where as businesses have grown and they're using different suppliers where the actual company did not have a supplier program in place, and 2017, 2018, where they had to start it from scratch, or where the supplier, was growing in business, they're providing a particular value, but maybe don't have best practices set up in terms of what that should look like as they partner with somebody that they're supplying to. So maybe you could speak a little bit to, and I don't want to steal your thunder if you're going to talk about this later on in more detail, but as when you first start to deal with a supplier, maybe some ideas of how you go about evaluating that piece of it, what that conversation looks like.
Yeah, absolutely. And we will get into that a little bit on the evaluation piece, but I think it's understanding where the supplier is in their quality journey, in their culture journey, where they are with their quality culture and their quality management system. There's so many different ways to implement a quality management system, and there's no wrong way. The regulations are written the way they are to allow that, and you need to work with that supplier, understand is their quality management system, is their way that they've set it up going to be able to meet your needs. So it really just goes back to this statement up in CFR 820 that says their ability to meet your needs. So if they're meeting your needs and they're set up to meet that, you're in good shape.
Okay, I appreciate that.
So, but we'll get into a little bit about evaluations, because there's different evaluations for different types of suppliers, based off the risk, but it all comes back to risk base. So then we'll break down ISO 13485, and 7.4 goes into purchasing and the purchasing process. And again, very similar 820. You need a procedure that conforms to specified purchasing information. So again, you need to document what you're going to do, and then communicate with that supplier on what you need. And you need to establish a criteria for the evaluation and selection of those suppliers. And you need to base that off the supplier's ability to provide the product that you're looking for to your requirements, their performance, the effect on the purchased product on the finished device. So, are you purchasing, go back to the same one, environmental controls, or are you purchasing a critical component that can cause harm to the patient if is not to the specification. So, you need to understand that piece of it. Then you need to monitor and reevaluate the suppliers. And what's interesting in this process is it also says the monitoring results should feed into that reevaluation process. And we'll get into that as we start talking about the scorecard, and then also the reevaluation process, or what I call the surveillance process. And then when suppliers don't meet those expectations, address based off product and compliance risk. So that's your non-conformance process in your system. That's your S-CAPA, your supplier CAPA system. How do you manage when they don't meet your expectations? And then keep records of your value. Go ahead.
Communicating that, and then setting up what that scar is going to look like in a way that you're going to be able to solve the problem and remediate it so that it goes away.
Absolutely. And it's all about, we'll get into it, but about the trending, how you manage that, how you look at the data. And if you're collecting the data, use the data, it'll guide you. And then, the final piece is keep records of your evaluation, your selection, your monitoring, your reevaluations, and then take actions from these activities. So use that data and use it. And, as the old saying goes, is if you didn't document it, it didn't happen. So, make sure you're keeping records, make sure, keeping all those records together so that you have that. Those are the first things that an external auditor is going to ask for when they come in and take a look at your supplier monitoring process and your approved supplier list. They're going to want to see those records, so have them ready, have them well documented, and be able to speak to them.
Chris, from a data collection standpoint, and as you look at some of those critical outcomes, how things are trending, how often, like in terms of is it a month-to-month trending ratio, quarterly, both? How often are you looking at data to determine changes in performance?
Yeah, so there's a couple different schools of thought on that, and I think the more often you can do it effectively, the better. So if you do it, say, monthly, and you have an issue with a supplier, a nonconformance or a trend of nonconformances in the first week of the month, they could have 3 more weeks of producing that same defect before you catch it. So if you can set up a process that's automated and you can do that weekly, you'll catch it a lot quicker. If you do that same thing quarterly, and the first week of the first month of that quarter you have an issue, now you have 3 months of production that could be potentially affected. So it really depends on what your risk tolerance is there and how effective and efficient you can create that process. So if you can do it weekly, that's ideal. I think at minimum monthly. Quarterly, you start getting into a lot of extra production if there are challenges, and you can react quicker. So ideally weekly. If you could do monthly, that's perfect too.
What have you typically done over the last few years? Is it been weekly?
Yeah. So when I took over the process originally, it was quarterly, and when you do it quarterly, then you have a delay in actually capturing that data and analyzing that data. So even though it's, say, 2 months ago, by the time you get the data, it's another couple months. So when we moved to monthly, we were able to react quicker. Have less of a challenge when those issues do happen earlier in the month. We have less production affected.
Awesome.
So from here, we'll move into non-conformance trending. So back to quoting the regulation, the non-fulfillment of purchasing requirements shall be addressed with the supplier proportionate to the risk. So again, risk-based decision on those non-conformances. How do we manage those? So, where are you getting your non-conformances from? They're incoming inspection, in process, potentially field complaints. So your post-market team should also be feeding back to your supplier quality team if there's any challenges there. And then define that non-conformance and grade it. So, again, going back to risk-based. So if a component is failing and it's a functional defect that can cause patient harm, obviously you're going to react a lot differently to that than if there's a graphic or a printing smudge on that product. So, grade that. Is it mechanical? Is it functional? Is it visual? And then based off that, set up your action plan, proceduralize your action plan on what you're going to do with those nonconformances and those types of nonconformances. I think the other piece here that is often missed is the regulatory piece. So, just because it's fully functional and fully compliant, it might have regulatory concerns if a supplier changed a material or things like that, or change manufacturing location. There's some regulatory implications there that you might want to take action on.
How often in the past 5 to 6 years has your team or you specifically got involved in terms of service and repair? And the reason I ask that question is one of the positions we've worked on in the last year. As you look at the MDR, you look at the changes in regulations, certainly there's a lot more liability to go around than there was previously. And that's one of the things that I've seen over the last 2 years, that more companies are like, wait a minute, we've been focused on this, but we haven't really taken these regulations and applied them to the service and repair aspect. So we've worked on a couple of leadership positions relevant to that. And a key aspect of that was, okay, it comes in, define, is it normal wear and tear? Is it a service scenario? Or is this something that had to deal with affecting the patient? And then it gets moved to regulatory, design quality, and compliance. So I didn't know, I was just kind of curious how much you interacted with that and how that ties into suppliers.
Yeah, no, that's absolutely great point. And it does have to be managed. You need to set that up. How you're going to manage those service pieces. The more and more products are being reusable, and as you get into power devices that have a longer multi-use, multi-patient type scenario, you need to understand that, and that should be set up all ahead of time so that you have that data. And when those events happen, you already have the guidance internally on how you're going to manage those and react to those. So define that nonconformance, and then what are we going to look at? You're going to look at the NC type. So what's the nonconformance type? The grade. What's that risk? The disposition. Did you use that part? Did you reject it? Did you return it to the vendor for sort? Did you have to rework it? What are those? Because sometimes you can trend off of that and potentially make design changes. Say, hey, we keep using this part over and over again that doesn't meet spec, but it's fully functional. Do we want to open up the design to make it easier for the supplier to be able to make that part? What did it go through proper early supplier involvement and things like that, and as part of the design? Can we open that up? The quantities, the part numbers, the part types, et cetera, et cetera. So, and then once you get that data, start tracking it, and you'll start to see trends and challenges in certain areas. So this is a graph I pulled, but there's the dimensional concerns, corrosion concerns, short circuits, tool marks. So there's all different ways to classify this, and once you have that data, you can leverage all kinds of tools like Power BI, even Excel, and be able to leverage that data and then start making smart decisions off it. But I think the key thing is when you're using it, track and trend it, but then use it, monitor, take action, and document those actions. I think just getting the data, you're only doing half the task. Use that data, take action, work with the supplier, understand those challenges, and then work with them to get through those challenges, because a lot of these are going to be repeat occurrences. So if you see a trend and react to that early, that trend stops, and then you don't have another series of the same defect year over year over year. So react to the trends, use the trends to your advantage.
Yeah, if you're collecting data and you're not evaluating it, determining how you can get better with it, and you're sort of wasting your time a little bit.
Yeah. I think way too many corporations just collect the data, check a box and then move on. But it's taking the action and documenting those actions for improvement. That's the supplier development piece. That's understanding your supplier, working with your supplier. You're partners with your supplier. If they do well, you do well. They are truly an extension to your clean room. So you need to make sure that you're working with them, and this is one way to help them. So then we go into developing scorecards. So supplier performance is in meeting requirements for the purchased goods shall be monitored. So, and then that monitoring shall be an input to the reevaluation process. So, a couple of factors to consider. There's many different ways to look at this, but here's a couple. Nonconformance, but then also nonconformance rate. Sometimes you want to have that data normalized so that you do nonconformance based off of how many receipts you've had. Supplier CAPAs, the timeliness of those CAPAs. Were they late? Were the responses adequate? Did they go effective or ineffective? Do they have proper management of those customer complaints? Supplier fault, product hold, or field actions. Did they cause challenges for you in your finished good? Organizational, so internal audits, external audits, and then third party results. Did they have any 483s for other matters? We just went out to a supplier a few weeks ago that had some FDA observations. We went in and double checked on those activities, and they got findings from us for the same areas because they didn't fix them adequately. So I think those are type of things that help trigger from a manufacturing standpoint of where your challenges are. So those are all quality. And then the last two, fill rate and on-time delivery. So I'm not a big fan of putting what I call purchasing or sourcing metrics in the scorecard, but it does fall in there. It can also help you understand how that supplier is performing. So if their fill rate, if they're expecting 1,000 parts a month and they're only giving you 800, what's going on? Are they closing off cavities in mold because they're getting flash? What's going on with that supplier that they can't meet that fill rate that they signed up to? Same thing with on-time delivery. Why are they late? Are they having other issues? It can also help trigger some supplier development opportunities.
So this is obviously, I'm going to assume that this slide is specifically your best practice slide, because I see Shurig Manufacturing up top there, and obviously we would be a best practice. So in terms of that evaluation piece, obviously you're looking at data on regularly, and you want to look at it as often as possible to identify trends and make sure you're creating process improvements and best practices. But from a reevaluation standpoint, do you reevaluate your suppliers on an annual basis?
Yeah, so it's based off their performance. So there's minimum requirements, but those requirements can get stretched out longer and longer if they're performing well. So especially in these times, in these lean corporations and lean businesses, you can't go out to every supplier every year. You just don't have the resources to do it. So you need to focus your effort on the suppliers that need your effort. And we'll get into that as we get into evaluations, but use your scorecard. If a supplier is perfect every single month, the parts that they're sending in, why are you going to go out just to go check a box to make sure they're doing what they say they're going to do? You could tell that they're doing what they say they're going to do because you're getting good parts. And I think as you start developing your scorecards and you start seeing trends, so as in Shurig Manufacturing here, there's some dips. August, September, kids are going back to school. Is the staff being affected by that? Coming back from January break, was there an issue there? So you start seeing trends year over year, and as you get that data, you can start monitoring it. Another thing to think about is, are you tracking it monthly or quarterly? Like we talked about, I recommend if monthly is ideal. If you can get it weekly, if you have the systems in place to be able to do it more often, do it, because you're going to get better data. You're going to get more granular data and be able to react to it quicker. Again, use the data. If you get it, analyze it. And communicate. Go ahead.
I was just going to say, so you've dealt with a large amount of suppliers. What's your experience been on the capabilities to get that data? Can you give us an idea, and those that are listening, what your experience has been? Is it typical that 70% of the suppliers that you've dealt with over the last 4 years can have the abilities to give you the data on a weekly basis, 2 weeks?
Yeah, so it really goes down to how large your business is internally. So when I'm working with 38 different manufacturing facilities, they may be all product of different integrations and purchase and acquisitions over the years, and they may be all on different systems. So if your business is on one system, it's much easier to be able to pull this data from your NCR reporting or your ERP system. Whereas if you're a conglomerate of multiple integrations and acquisitions and divestitures, it may be a lot more challenging.
Because you got more steps because you have so many systems.
Yeah, it's combining that data, and it's not always apples and it could be apples and oranges. It's not always the same data sets and things like that as you get into larger corporations. But if you're a smaller company with minimal sites, for example, this graph is up here. Each colored line is a different manufacturing site, so you can see how they performed. They may be performing great for this supplier or for this manufacturing site, but this manufacturing site had a challenge. So it gives you that granularity of the data and understand where your challenge is coming from. So that's the bottom bullet here is do you have multiple manufacturing sites? Does the supplier have multiple manufacturing sites? We have many suppliers that one of their manufacturing sites is awesome. Every month, 100 scorecards, and then 100% scorecards, and then some suppliers, their sister company is horrible. So you need to be able to break that data down and see it down to that level so that you can use these scorecards and make decisions off it.
Mergers and acquisitions too, a huge.
Absolutely.
I mean, client, we were working on a position this last holiday around that time, and they had grown so much, certainly organically, but through a couple different mergers and acquisitions. So from a sales comp standpoint, they're pulling data from 4 different locations. From a supply standpoint, so a lot of their metrics were on different systems, and it was a real challenge to pull all that data in and convert it to apples, and then make decisions from it. So that certainly affects it as well.
Absolutely. Yeah, it's they might have the same top level quality management system, but how it's implemented at each individual site could be totally different. And it goes down to quality culture too. Your supplier scorecards could be a result of excellent culture, or they could be functionally excellent, or a mix of both. So there's a lot that goes into it, and that's what the scorecard helps you understand and drive. So it's actually a very important piece of monitoring your supplier. So now we go into the initial supplier evaluation. So, who, when, how, so who, FDA 1345, you need to evaluate everyone, no matter who they are, what they're providing, you need to evaluate them. My perspective is, you're going to want to audit those high risk suppliers. Everyone else, you can do some type of supplier assessment, understand what their quality management system is. Do they have ISO certifications in their field? Did you review their credentials? So if you're hiring a consultant for design work, do they have the proper proper credentials for design work? So you can do comparisons like that to be able to understand, what you need there. Initial. Go ahead.
When you're picking that supplier and you're having that initial evaluation, what does that typical time frame look like, and how many different data points or items are you looking at before you make that decision to move forward?
Yeah, and you really have to get in with your advanced sourcing team or your new product development team and understand who they're selecting and work with them early. The earlier the better. We all the time we have teams that come, hey, next month we want to start using a supplier. Too late. You should have done this 6 months ago, because it takes time to get in there. Takes time to get to the supplier, especially in these times. It's going to be tough to get in the door. So you want to plan ahead. You want to get that selection piece done very early in your process. Really when you're starting to finalize prints and you're starting to look for suppliers, that's when you want to bring in your supplier quality team. You want to get that done early. Because the supplier quality team might go in there and say, this guy's a mess, you don't want to use them, and you're going to have to go find someone else. So getting in there early, understanding the supplier's capabilities is critical to success. So when you do that early, very early, and how are we going to do that? There's many different ways. Quality system self-assessment, so based off of risk, if it's a lower risk supplier or lower risk component for your device, a self-assessment might be appropriate. Reviewing credentials, leveraging third-party standard certifications, things like 17025 for, calibration, things like that. Perfect use of that. On-site audits, you can either do a quality management system audit if you've never been there, or dig right down to the process audit on what they're doing. And then, potentially remote audits. Sometimes that's your only option. Whether you don't have local staff, whether you don't have the budget to get your team to that supplier, if it's across the globe, or you frankly can't travel due to the COVID restrictions or things like that. So there's options there to get that assessment done. So surveillance evaluation. So this is our piece of monitoring, leveraging our scorecard and saying, okay, well, these are the suppliers that we need to get out to. So you're going to want to audit those high risk suppliers. You want to get in there and see their process firsthand, see what challenges they may be having, and work with them and make sure that they have the proper controls in place. You're going to want on-site audit your performance challenging suppliers. So suppliers that are hitting your scorecard over and over again, you should have a mechanism that leverages your scorecard to guide your audit process. So create a schedule, whether it's, hey, I want to go out every 2 years and audit the supplier, 3 years, 5 years, whatever it is, stick to it. The first question an external auditor is going to come in and ask is, hey, let me see your audit schedule. Okay, let me see the audit for XYZ supplier. And when you missed your date or you didn't stick to your schedule, it's an easy finding for them. So create a schedule, use a risk, stick to it, and then leverage your performance monitoring results. So again, when you go back to the regulations don't say that you need to audit. So if you're going to create an audit schedule, stick to it, because it's not a requirement. But if you say you're going to do it, you're turning it into a requirement. So make sure if you're doing it, you stick to it and leverage your performance monitoring to tell you where you need to go and how often you need to go there.
How many different sets of eyes do you have looking at that data that you're obtaining from your suppliers?
From performance monitoring standpoint?
Uh-huh.
Yeah, so from performance monitoring standpoint, we review that with all of our sites, with all of our sourcing counterparts. It's really a cross-functional team that's looking at that. We want to make sure that everyone is aware of how that supplier is performing. Advanced sourcing, when you're talking about new product development should know how your sustaining suppliers are doing, your regular commercialization suppliers, because if they're not performing, 10 years after new product development, do they want to start a new project with that supplier? So you want to make sure that you're getting that input to the new product development team also. So to have that cross-functional team looking at the data, understanding data, even if you're just escalating up the key points to those more outside cross-functional teams, I think it's important.
Yeah, no, that makes sense.
So then you go on to the how. So there's a couple different ways you can, on-site QMS audit, on-site process audits. You can leverage a third-party auditor. You can leverage third-party auditors like Medtech, where they'll do a deep dive into your process, into a specific process of that supplier. So there's many different ways to do it. And then there's also, desk audits or remote audits, which, we've obviously been turning to a lot in the recent history. And then, don't forget, ensure the supplier has the ability to meet your specified requirements. So when you're on site, when you're auditing your supplier, if you have a specification that goes down to, 10,000s and they don't have a measurement equipment that goes down to 10,000s, how are they going to meet your requirements? So things like that when you're on site to dig in deep, make sure they can meet your requirements, make sure they have the personnel, the tooling, the equipment to be able to meet those requirements. I think that's a big miss. A lot of people, and they struggle 2-3 years post NPD when they start struggling with tool wear and things like that, and parts start to shift. Clearly document results. As we said before, if you didn't document it, it didn't happen. And partner with your supplier. They are an extension of your clean room. Work with them. Understand that, yes, you're there to audit, you're there to assess their quality management system, but after that finding is written, work with them. Understand, hey, these are some ideas that you could do. These are some what I've seen in the past. This is how we can improve this process. And then again, stick to your schedule. If you're going to write a schedule, stick to it. It's simple. Write that schedule, risk-based, and then stick to that schedule moving forward.
And they want to be successful, obviously, as well. So if you're sharing best practices and outcomes that you've been able to implement with other suppliers successfully, obviously that's a win-win, and it's a relationship that then is going to have the ability to last.
Absolutely. 99% of suppliers want to partner with you, want to listen to what you've seen. If you think about it, your audit team is going out and seeing, say in my case, 200 suppliers a year. That's 200 different ways that they've implemented the quality management system at the supply base. So the knowledge there is incredible. Every supplier should be wanting to leverage that and work with you to get better.
Right. Yeah.
So from there, surveillance audits, we're gonna go on site. Well, not today. No visitors. We see all the time now that no visitors due to COVID-19. Will not be allowing visitors at this facility. So how are you supposed to do a quality management system audit or an on-site audit where you can't get on site? Right. So, as in March, March, April, we're rounding out our audit schedule and all of a sudden, boom, no more on-site audits. You can't go anywhere. You can't travel to suppliers. What do you do? So you take a look at what are the challenges potentially of doing a desk or a remote audit, and you take a look at what are the concerns. You can't randomize the evidence, so a supplier can really cherry pick what data they're going to give you because you're not on site. You're not being able to pull specific part numbers or specific documents that you see during your walkthrough and things like that. The added complexity of the time to assess the procedures, the files for review, all that adds up time. You're not going to be as effective interviewing the auditors or interviewing the auditee. You won't be able to read their facial expressions. You won't be able to read them when you're going through an audit, the body language, things like that, where you don't have the ability to observe and assess those nonverbal communications. And then the lack of ability to evaluate the supplier implementing the product identification, the inspection status, non-conforming material, quarantine areas. You can't do that walkthrough. So,
Chris, have you seen? So I've witnessed a couple different scenarios over the last 2 months where some of those auditing, they're actually doing video auditing, so they can see some of that you just talked about, that human aspect, right? And then I'm curious to get your thoughts. One of our global clients they used to always have 2 auditors on site for their facilities, and now they're creating a sort of a remote COVID auditing plan where now they're only moving into next year. They're only going to have 1. The other one will support remotely, but trying to create some of those efficiencies because of the pandemic.
Absolutely. You got to understand what those challenges are and then put workarounds in place to get through them. And that's what we'll go through here is how do you reduce that impact? So, for the last 20 plus years, we've been auditing suppliers on site, going through their processes, and it's a new process. So how do you remove some of these challenges? So, when you're randomizing evidence, upfront planning to understand the population of available records. So many suppliers are open to uploading files in advance. If you know what you're asking for, work with your manufacturing site or sites and understand where are your challenges. Where do you want me to focus in when I go to supplier XYZ? So getting that information up front and understanding that will help maximize those data requests so you can get a better selection of those data over that data. Obtaining those procedures ahead of time and then taking the time to go through them so that you're not reading them when you're on a WebEx or whatnot with a supplier or on a Zoom call, so that you're knowledgeable of their process before you're going in. So you're building that efficiency right in. And then, electronic tools, using Box, WebEx, video chat, Zoom, things like that. Many suppliers are open to, well, let's take the computer around our manufacturing facility. I'll show you XYZ. I'll show you our quarantine area. I'll show you our calibration area and walk you through those things. Some suppliers won't. Some suppliers will want to just, hey, here's the videos. I'll send you videos of the sections, but we don't want to go through live because we may be distracting the manufacturing personnel. So you got to be flexible. You got to work with the supplier and understand, the best ways to be able to get that information.
And I mean, you spoke to this earlier, right? But I always say in our office that every time you interact with somebody, you either gain credibility or you lose it. And from the same standpoint, if you've got a relationship, there's trust that's been built there, the outcome and the trending makes sense, then there's going to be more flexibility there, you would expect.
Absolutely. And, and to that point too, work with the supplier. Make sure you have a non-disclosure agreement in place with that supplier. Make sure that you're building that trust through legal means if necessary, with a non-disclosure. That'll help, kind of break down some of those barriers. There's obviously COVID brings a lot of barriers, and how you can overcome them is how you're going to be successful. If you just say, oh, can't go on site, can't audit, it's not going to work, maybe next year, you're not going to get it done. So you got to figure out ways to get through those barriers or around those barriers. So, electronic video chats, and then, be clear with the supplier that, hey, if we have concerns, we're going to want to come on site, when things open back up, when we're lit, this might be the first piece. It might be all of the audit, but let them know that, this isn't a one-stop shop audit. We might come in more if we do find, some risk there. It's not a, hey, this is my audit for the year, I'll see you in 3 years. There could be challenges, and be upfront and honest with the supplier. I think that's the important piece.
Well, just like you talked about, you're collecting the data, you got to evaluate the data, you've got to understand where your potential gaps are. It's, we had the educational webinar we did on quality management system integration and remediation with the tool Sana in August. And one of the warning letters and issues that he talked about, that particular quality management system, which was an acquisition, they had not looked at the design history file and looked at it from an oversight standpoint for several years, which is why they got in trouble. So if you're not evaluating your processes and you're looking at the data to make sure that you actually have best practices, certainly you're going to have problems.
Absolutely. Absolutely. And then the final piece, how do you get through some of the, evaluation of different areas? Use those videos, follow up if need be. I think there's plenty of ways to overcome those challenges. You just gotta think through it, and then work with the supplier, and then partner with them, and just make sure everyone's on the same page. So then what you're going to switch gears a little bit and say, hey, you probably have an audit team, you probably have a team across the globe, or just down the street at their home, and they're working remotely. How do you manage that remote staff, and what are some tips and tricks that I've been using over the last 6-8 months to get through this? And it's call, text message, communicate, check in. When you get to the office in a normal world, you walk in, you grab some coffee, you say hello to Sally, say hello to Bill, you see everyone, you have that FaceTime. Try to recreate that through messages, through, if you have a Jabber system or a messaging system, reach out to them every morning. Say hello, even if it says, hey, good morning, how you doing? Things like that to break down those barriers. Try to recreate normal working world, because every time you stop, grab a cup of water or grab a cup of coffee, walk by someone's cube, you're having those interactions, and in today's world, you're not having them. It's very quick, and if you send a message, it's right to business. It's never, hey, good morning. It's you got to fight through that urge to get right down to business and greet people again, and get back to, well, it's electronic, but I still need to greet. I still need to be a person. At the end of the day, your team are people, and you need to work with them.
I know, just even from the FaceTime standpoint, since the pandemic started, friends, family, even from a business standpoint, you get up to 4 people on there and all see each other at one time, has been a great tool that we've personally used effectively.
Yeah, absolutely. Any type of video conferencing, increase those group meetings, add video conferencing, let people see you, let them, see your home office, things like that. They kind of break down those barriers, all good techniques. Recently we've been doing what I call coffee break calls, so set up a half hour, put a Zoom meeting or WebEx meeting, have the videos rolling, and just have that coffee or water cooler conversation. No work talk, just icebreakers. You can do lots of classic team building games just do them via Zoom. Ask each other questions, no work talk, and just enjoy each other's company and break down those barriers, because there's new barriers with COVID, and we need to understand how we break them down, how we build that teamwork back up, and work with each other.
And I'll just for a little comedic relief at that point, you don't want to be the news guy. I can't remember which network it was, but a couple months ago was on a video and he had no pants on. So as we always tell every person in this COVID age, we're doing a lot of video interviews. Wear pants, dress completely like you're live in person.
Absolutely. And I think during coffee break calls like that, you be a person. Sometimes my kids will walk into the call, and let your guard down. Be a person, and that's how you're gonna link in with your team. You're gonna help drive that camaraderie with your team. We're all going through it together. So don't be management like. Be a person and work with your team.
A lot more dogs barking in the background.
Absolutely.
We
just gotta be quick on the mute button.
We just filled a vice president of quality position a couple weeks ago, and I got to meet the chief human resources officer's son and all kinds of other things, right? Because everybody's at home.
Yeah, absolutely.
So you got to be flexible.
Yep, absolutely. And set realistic expectations. And ensure the team has the right tools to succeed. Do they have, an extra monitor? Do they have a docking station? Things like that when they're home, that you take for granted when you're in the office, that, you have a printer, you have all the tools to succeed. You have plenty of monitors to work effectively and efficiently. Make sure they have the right tools, and encourage your team to set hard starts and stops. I think, with COVID, you see people roll out of bed, grab their coffee, move over to the computer, 7 o'clock, start working. And then before you know it, it's 6 o'clock and you're like, oh, I forgot to eat lunch and things like that. So, set hard starts, set hard stops. Remember that you can't work 24/7. You're going to burn out. You need to have that personal time. You need to have that family time, and encourage that, because if it's coming from your manager, people are more likely to set those hard stops. If it has to go said, don't let it go unsaid, because people will just think it's the norm, and you got to reset that. You got to reset their clock and say, hey, hard starts, hard stops. The weekend is your time. Stop answering emails on the weekend. Stop answering them after 8 o'clock. The work will be there tomorrow. Important projects, yeah, there are exceptions, but you got to get back to normal, quote unquote 9 to 5 type work, because you're going to burn out.
You have to set parameters and expectations of what's important from that standpoint. And I know, before I started my business in 2015, I spent 12 years in a remote office traveling. And when I was not traveling, then I was in my office. And I always say, I think the wrong people from that standpoint typically don't end up in those type of positions. You hire the right people, they have to be very careful, because you end up working all the time, to your point. And
Absolutely.
Certainly there's times you're going to work on the weekend, but you got to set some guidelines, because you'll end up working on, all the time. One of the regulatory affairs managers that we helped with a position, she started last July, and I was talking to her a couple months ago, how are you doing? What's going on? And she's like, man, I used to commute 45 minutes one way. So I've almost gained 2 hours back into my day, and I feel like I'm working more. Yeah. So, because people, anybody in these type of positions, they're successful, educated, and they're doers. So you've got to set those expectations.
Yeah, it's very easily start rolling your commute time into your work time, because it's, you've already lost that time in your mind that, hey, it's 45 minutes each way. That's an hour and a half of my life I waste every single day. Now you start working, and you got to roll that back and set those hard stops, Absolutely. And then, from a management standpoint, reach out to your team, let them know, hey, take advantage of your time home with your family and friends. Don't get burned out. You use those hard stops. You're not commuting. That hour and a half, spend with your family, spend with your friends. Work an hour early, leave at 4. Go enjoy the summer, go enjoy the time. You don't get it back. Once it's gone, it's gone. So enjoy it. And then be flexible. As kids are starting to go back to school, hybrid, non-hybrid, 100% homeschool, 100% in school, be flexible. You need to be, because these are new barriers, and as long as the work's getting done, you need to be flexible. And that's how you're going to keep good players on your team. Because if you're not, they're going to look for something else, and you're going to lose some good people.
Absolutely. So I know that we talked about the fact that if anybody had specific questions or would like for Chris to dive in a little bit deeper on a topic that you have a question with, feel free to send it over now. If you think about something after this, so we'll give a minute or two here for anybody that wants to send a question over that Chris can answer. If you think about something after the fact, feel free to email me at my personal email or my work email if you have that. If not, you can send it to info@shurigsolutions.com. We'll share it with Chris, and then we'll post it after the fact. Certainly we'll be posting this conversation as well as creating a white paper for it as well to share with our audience. But if anybody has any questions, we encourage you. I think we have one right here. So Edgar asks, in your experience, how do you get your suppliers to effectively monitor their suppliers, Chris?
Yeah, it's a great question. And, a lot of times, in med device industries, we're telling the suppliers on who to use and things like that, which adds a whole entire different dynamic to that too. But, I think you need to communicate with your supplier. You need to partner with them and make sure that they know that, hey, you're responsible for whatever's coming in your door. If you're receiving bad product from one of your suppliers, you need to monitor them. You need to work with them and partner with them, just like we are with you. You need to partner with them. They're an extension of your manufacturing floor. So you need to make sure that you're monitoring them. You need to set up appropriate supplier controls. You need to understand, what's coming in your door. You're responsible for it as it comes in your door. I'm responsible for your parts when they come in my door. So it's the same thing in making sure that, from a quality management system, that they're set up appropriately.
So on that note, and a lot about, I think, the successful implementation of this stuff is proactivity versus reactivity, right? So one thing, do you use scenarios without having issues with confidentiality for sure, but do you use success examples relevant to a supplier that you're not having issues with, that you don't have to audit as much because you don't have problems with them, and share those metrics in a way that's confidential with a new supplier, or to Edgar's point, that they can share with the supplier to say, look, this is the expectation. This is what we need to get to.
Yeah, no, absolutely. And we leverage, those performance criteria with like suppliers. If you have 10 molding suppliers, we let them know that say, hey, molding supplier A, B, C, D, and E, this is how they're performing. This is how they're performing against you. Obviously, we don't give, suppliers names in those discussions, right. But they know who they are. They're all competing for the same business, and that'll push them harder. And then, that's how you develop your suppliers too, is understand, hey, supplier XYZ doesn't have these challenges. How are we going to change our system so that we don't have that? So absolutely, leverage that performance monitoring, leverage the data that you're having in any way possible, and make sure that your suppliers are reaching and continue reaching for those best practices.
Competition, I always say competition makes all of us better. And
absolutely,
certainly from a proactivity standpoint, and we put out a lot of messaging relevant to this here over the last few months, but making decisions based on your value system and then measuring your outcomes. And you pointed to it several times on a regular basis, not only measuring it, but evaluating the data to make sure that you're putting your best foot forward to create those best practices.
Absolutely. And then using that data, get it, evaluate it, and then use it to drive those best practices.
That's great.
As we wrap up here, some final thoughts, communicate, whether it's with your supplier, with your team, especially in these COVID times, you got to communicate, you got to over communicate. If you think you communicated enough, do it again. Use the data to drive those improvements. We've hit that probably 30 times today. It's important. If you're going to collect it, if you're going to spend the time to do it, use it. Partner with your suppliers. If they fail, you fail. If they succeed, you succeed. They're an extension of your manufacturing floor. Whatever they're making is coming to your floor next. So if they're successful, you're going to be successful. Yeah. Work with your team and supplier. Understand there's challenges, and then help them break it down. That's your job in supplier quality. That's your job as a manager to understand those challenges and then help break down those barriers. And then protect the patient. Never lose focus of why you're in medical devices and what you're making. You're not making a screw for a couch where that couch, if that screw is bad, the couch falls down. You're making a medical device. So medical device, here's a screw example, for a spine. Where does that go? That goes in someone's neck. That's pinning their neck in place to prevent spinal cord injuries. And this one hits home for me. Back in late July, this is a picture of my dad's neck. He tripped in July and literally broke his neck. And when I got the call, he said, "Hey, I'm going in to surgery, and doctor just told me I'm using your company's product, and I'm getting about $20,000 worth of screws in my neck to pin it all back together." And you got to reflect back why you do what you do. And you have to remember that, these are patients every single day that are being affected by your product. So the decisions that you make affect people and patients' lives, and not just the patients, the doctors, the family members. It starts multiplying and compounding when you think about how many people get affected by each and every patient. So, whatever you're doing, supplier, work with your suppliers, let them make sure they're understanding what they're making, why that part is important, why those dimensions are important. Oh, just a little foot of flash, don't worry about it. That's, you got to bring it back to the supplier. Well, that flash can cause the device not to, function properly and potentially could, harm a patient. Bring that back, bring that quality culture back in everything that you do. I think it's the most important piece of everything here is, remember who you're working for. You're working for
absolutely
that patient.
That's the reason why we're in the space. Certainly my business, that's why we're in the space, because we want to help people get opportunities that work on products that benefit patient populations. And I think, I just had a conversation with Joel Mollings. We did a few weeks ago. That's one of the cool things that he talked about in terms of clinical quality, regulatory. People have a mission. They care about what they're doing, not just because they want to do a great job, but they care about how they're benefiting people. And I think that's what it's all about. So you hit the nail on the head. Absolutely. Is any other questions? I know we're at the end of our time here. Again, if somebody thinks about a question after the fact and would like to send it over to us, please do. Chris, couldn't thank you enough for your time. And, you are a great leader. Certainly I would let you lead me in supplier quality any day of the week. And I love your mission in terms of how you treat people, how you want to interact with the people that you work with. And certainly whoever, as your career continues to grow, is going to be very blessed to get to work with you. So thanks so much for coming on. I hope this brought and I think you're muted as you switched off. So I just unmuted you. I'm going to go back to our camera screens here, but thank you everybody who attended. Hopefully this brought you value. Again, we'll be making, we'll publish this later on. So anybody that was registered but wasn't able to make it for whatever reason will be able to see it. We'll be creating the white paper for it as well. And if anybody has any post questions for Chris, again, feel free to send them over. We'll get those answered. But we really appreciate your time. We hope this brought you value. And Chris, really appreciate your time tonight.
No, thank you for having me on. I really appreciate it. And, you know, as Darwin said, if you have any questions, I'd love to hear from you. Reach out, you know, write to Darwin, right in LinkedIn. You know, I'd love to hear from you and, you know, talk supplier quality. So I appreciate it.
Awesome. Have a great night, my friend.
Take care, everyone.